Hi everyone, and welcome back to our next session on the Healthtech and MedTech track. It gives me great pleasure to introduce our fireside chat, Innovation and the Future of Chronic Disease Management, where we have Glen Tuilman, founder of Livongo, speaking to Tina Tan, executive editor of FirstWord Healthtech. As mentioned, and as always, please do put any questions that you want answered into the Q&A chat, and we will try and get to them as quickly as we can, but time flies when you're having fun. So without further ado, Tina, Glen, over to you.
Great, thanks, Becky. Hi, everyone. I'm Tina Tan, the executive editor of FirstWord Healthtech, and I have the great pleasure of hosting today's fireside chat with Glen. So Becky had said that Glen is the founder of Livongo. He is actually currently managing partner of the health tech focused venture capital firm 7Y Ventures, which he started up with his longtime business partner and friend Lee Shapiro in 2014. But, you know, perhaps the company that you would associate Glen most closely with is Livongo, one of the big success stories for 7Y Ventures and in digital health, specifically the chronic disease management space. Now, just a bit of preamble about Livongo, although I'm sure this you all know already. Livongo started in 2014 and 5 years later went public in a significantly upsized IPO in 2019. Then, of course, COVID happened and propelled digital health to the front and center of healthcare. And from this, we saw the biggest pure play digital health M&A deal take place, which is Livongo being acquired by Teladoc for $18.5 billion. So we'll hear more about Livongo's rapid rise from Glen very shortly, but I'd like to spend a few minutes just hearing more about his journey into digital health. So welcome, Glen.
Well, thank you, Tina. It's great to be with you and with all the viewers here today.
So your career is firmly embedded in tech, but what first stoked your interest to go down the health tech route?
Well, it's interesting. I think there's really two different paths. One was, all of us are users of the health system. And I think in today's world, many of us have been dissatisfied with the role that health has played in our lives. We just simply know we can do better. And, this came really into focus with me some years ago. I was embedded in the tech sector and using technology to improve our lives in many other areas of the economy. And, I started to get interested in technology for healthcare. And I wondered why every other sector of our economy, we could use technology to improve the quality and reduce the cost. And healthcare and education, the two most important things to all of us and to our children, both of those seem devoid of technology. And in fact, in many cases, we were told that you couldn't apply the standard business principles and you couldn't apply technology because they were too important. And yet, those are the two areas that were lagging in every metric we had for quality and cost. So I first became interested. I started to look at how could we improve the quality of care that we were providing in hospitals. Then we moved from there to electronic prescribing. And we became the first to provide large-scale electronic prescribing. And that was interesting because there was a report many years ago from the Institute of Medicine, and it said that in the US alone, there were almost 7,000 people a year who died from preventable medication errors that had to do with the writing of prescriptions, bad handwriting, people who gave the wrong dose, et cetera. 7,000 people a year. And I was astounded by that number. And I knew that we could fix that by simply automating the process and add a lot of value. So once I became interested there, we started to look at healthcare. And I said, this is not only a big problem that we have to solve for the world, but it's also an amazing business opportunity. Because the funny thing about healthcare is the better we get at it, the bigger the problem gets. And what I mean is the longer we keep people alive, the more they need hip replacements and the more they expect us to solve all their other challenges, which we can do. So that started my journey into healthcare. And then more recently, I said, there's simply no other place I really want to focus other than healthcare, because there's this wonderful feeling of knowing that you've really made a difference for people. And that became clear with the founding of Livongo. My youngest son, Sam, was diagnosed with type 1 diabetes, and I watched his journey, and I knew that we made it harder for him to stay healthy, not easier. And you say, why would it be that we wouldn't make it easier for someone like him to stay out of the hospital and to take better care? And yet our whole system, particularly in the US, I think other countries have done maybe a better job, but in the US, we spend more money and have lower quality than we should. And my partners said to me, maybe they just wanted to get rid of me out of our venture firm, and they said, you ought to go do this. You ought to solve this problem. There's nothing more personal to you. And that's really, in part, the genesis of Livongo.
Yeah, that's really interesting. And I have to say that number you threw out about the 7,000 people just dying from badly written prescriptions, that's really quite shocking. And now back to Livongo, that's, you know, a lot of people do start up companies because it touches them personally. And like you say, you know, your son Sam has type 1 diabetes. And the thing is, Livongo's what Livongo's solution is something beyond what I suppose when you started it. Was there much competition around at that time? Because there's always been, I think people have always been aware that within diabetes, there's always a need for better control and management of their blood glucose levels. And, you know, the diabetes companies have been putting out, they've been working on continuous glucose monitors, and that's on the device side. And Livongo brings in all the sort of broadens that out, doesn't it? I mean, there's a device perspective, but I mean, what do you do with all that data? How do you make that management better? Maybe you could talk a bit more about the starting blocks of like a Livongo's solution, and how, you know, when you're putting this out to you know, potential clients, how did you sell it in a sense?
Sure. Well, you know, it's interesting, and it really did start from this idea of an experience. So it wasn't about a product. And early on, people didn't understand what Livongo was. Some people said, well, are you strips and meters? Other people said, are you data science? Other people said, you know, are you care delivery? So, you know, because you're doing coaching. And the answer was yes. The answer was some of all the above. What we really wanted to do was make it easier for people to stay healthy. And we wanted to empower people with chronic conditions to live better, starting with diabetes, but eventually, as you mentioned, expanding. And, you know, today, if you think about most healthcare, no matter where in the world you are, it happens to us. So a doctor tells us, she tells us what to do. And here's what's going to happen. And God forbid if you get cancer, here's what we're going to do. And here's what, wait a minute, what about us? How do we get back into this equation? And if you look at healthcare, despite all of the research and all the dollars and all the effort, today for most people, healthcare is more confusing, more complex, and more costly than ever before. So you could say, but I don't understand it. We have all these smart people and all this money being invested, and yet it's more costly, more confusing, more complex than ever before. And so as we looked at Livongo, we said, how do we make it easier to stay healthy? How do we put you back in charge? And how do we change the entire experience and deliver that on your terms? So instead of telling you what to do, and some of this was really simple. For example, when you call a normal store for customer service or a hospital, and they say, how can I help you? But that means if I say, how can I help you, Tina? That means I have the answers and you're asking the question. Instead at Livongo, we would say, Tina, what do you need right now? Because only you can answer that. So we're putting you in charge. We change the words. I like to say, if you're going to change the world, you have to change the words. So instead of calling people diabetics, we said, no, they're people and they happen to have diabetes. And that's simple change. Instead of saying you're going to do a test, you're going to test your blood sugar, we said you're going to check it. It's not a test. It's not a pass fail. It's an ongoing part of your life. So we tried to make this an experience and do it on your terms. So if you had a question 24 hours a day, you could call us and get a response within 60 seconds. It wasn't a press 1 for this, press 2 for this. It was a person. That person knew who you were. They knew what your numbers were because they could see real time what's going on in your body. And they could provide you unbiased information that was just about having you get through that particular situation and making sure you stayed as healthy as you could. So people understood that. And, when you talk about the milestones, everybody seems to focus on the largest digital healthcare merger in history, $18.5 billion. But most of the people at the company were excited about the fact that we crossed 1 million people who woke up every day using Livongo software to make their lives better. And about a third of our people actually had a chronic condition like diabetes or hypertension or weight management or mental health challenges. And either they had it or they had a family member. So the amount of passion and energy behind the business was extraordinary because it was personal. This wasn't some product. This was the experience that our loved ones or that we have every day. And that's the beauty of healthcare because everybody understands it. We all have something that we're dealing with, and our job was to make life easier.
That's interesting because you mentioned that element of experience, because within digital health, and I guess in a more traditional healthcare and traditional medtech, I suppose, user experience isn't something that's ever taken into consideration, whereas it's so important within health tech. And I guess it does require some level of change in mindset. I mean, how did you, it's one thing to get buy-in from the consumer who is using Livongo's product, but then obviously you went through, I believe, the employer channels first. You got employers to offer it to members of their health plan, to employees, and that is something that I'd like to touch upon quite, if we could, in detail, because commercializing and monetizing your health product is all part of the success of a business. So within these employer channels, is there any sort of is there any other sort of ways that you could expand beyond to, say, the payer healthcare channels as well?
Yeah. I mean, it's a great question because we did take a different tact, and that was that we had to find people who had a vested interest in keeping their employees, what we called our members, healthy and productive. And so rather than going to the payers, remember the payers and the PBMs have been working on this for the last 20 years or more, and they haven't made any progress. They hadn't made it better. They hadn't made people healthier.
Can I just jump in there? Why do you think it's taking, is it because of just bureaucracy?
Well, I think it's a number of things. One, sometimes there is a status quo and people make money from the status quo. We'll talk about the future of healthcare and where it's going, but one challenge we have is today the payers, the PBMs, the pharmacy benefit managers, and the health systems all make more money when we spend more money. So the incentive for them to dramatically reduce the cost of healthcare simply isn't there. And I think large self-insured employers have understood that. They've said there's no alignment, because if I go out and I pick one of the big names in healthcare and I say, if they announced next year our goal is to cut our revenues in half, well, they aren't going to do that. And so there's not really a burning incentive for them to reduce the cost of healthcare or to improve the quality of healthcare. And I think what we're going to see is innovation is going to come from the outside. So, many people, there was a great quote from Jeff Bezos from Amazon. He said, I've never had an industry where so many people ask us to get involved. Why are they asking someone outside the industry to get involved? Because they're not satisfied. So we went directly to the self-insured employers and we said, we think we have a better way that will empower your employees, keep them healthier, and then reduce your costs. And they were so frustrated because for years they haven't seen their costs go down or the quality improve. It'd be one thing if we had much better quality and the costs were going up. At least then we could say we're getting value. But large self-insured employers in the US and now the mid-size haven't seen that. So they were willing to experiment with Livongo and with many others. And what they saw was that after using Livongo, not only were their people healthier and happier, and measurably so, but they actually reduced their overall cost. So we had metrics at Livongo where we said that people used to not just like us, but they loved the product because it was on their terms. So they weren't told, well, you come in next Thursday in the middle of the day and interrupt your work. We'd say 24 hours a day, you call us whatever you need. If they lost their meter, we would FedEx them a meter the next day, a connected meter. We wouldn't ask them why. We wouldn't say, give me the details, fill out a form. We were focused on them. Now, some people would say, well, what if they take advantage of you? We were willing to take that risk. We trusted our members. And we said, look, we believe they just want to be healthy. And for their strips, in most cases, there's a copay before you get your strips. And I can remember from my own son calling up our health plan and saying he's running out of strips. And they said, well, we can't send you strips for 2 weeks, but we can send you needles. I said, but I don't need needles. I need strips. He needs strips to stay alive. And they said, well, if it's an emergency, go to the hospital, go to the ER. And I said, well, I'm in this business. That's terrible advice. And yet, even today, that happens. And at Livongo, we said, not only are we going to send you free strips, but we're going to do it in advance because we know how many you're using because of our data science, because you're connected. So we totally changed the experience that people had. And what we were able to do was show people liked it. We could show that they were actually healthier. We could prove it. And then last but not least, we reduced the cost for large self-insured employers. And so that started a snowball where they all talked to each other. Then the payers came to us and said, wait, you're carving out a part of our business. We want to be a part of this. So they joined in, the PBMs joined in. And that's really how we developed the business. And today payers do play an important role, as do some of the PBMs, but some of the PBMs have also gone back to the old ways and said, we can make
Oh no, I think we seem to have lost Glenn. It's one of the one of the trials and tribulations of a live event is that sometimes this happens. Oh no, I think we've got Glenn back.
We're back.
Welcome back again, Glenn. So
thank you.
Yeah.
So I don't know where you lost me, but I was just saying that what we want to build in every area, and I think this is the future, is a consumer, not just consumer focused, because consumer focused means that somebody else has the power and they're focusing on you as the consumer. We want it to be consumer directed. Consumers are in charge of their healthcare. Consumers in the future are going to make the decisions of where do I want to get my healthcare, and they're going to say, I want a product that tells me what is the quality, what is the cost, what is the experience like, just like we buy every other product. That's how we're going to experience the future of healthcare. And I think we're going to see that. We may see it from people inside the industry, but we're clearly going to see it from people outside the industry, from new startups.
Yeah, indeed, your your message about us moving towards a more consumer-centric sort of healthcare model really resonates across the industry. I think even traditional medtech companies who focus on the physicians do understand that too. Now, your success has inevitably spawned a lot of competition, and the remote chronic care space is pretty crowded, I'd say now. I mean, how do you think companies out there are differentiating themselves from each other? I'm talking about those that claim, to offer us very similar solutions to what Livongo is offering, and also, targeting those disease areas like diabetes and all the comorbidities, hypertension, etc.
Well, in today's world, I don't think there's any real competitive product to Livongo. And I'm saying that now no longer as the CEO or the executive chairman, but simply there's no offering like Livongo in the market today. One of the reasons that we did the merger with Teladoc is our members would call us, and sometimes they'd call us in the middle of the night, and they'd say, we're calling because we have a sinus infection. And we'd say, well, why are you calling Livongo? We're chronic conditions. And they'd say, you're the only ones who'll answer in the middle of the night, who'll pick up the phone, and who know us and we trust. And based on that, as we sat around in our leadership team, what we said is, well, if that's the case and we're taking care of the whole person, because we're not just silos, we're not just a person with diabetes or a person with hypertension, we're a whole person. And we said, if we want to do that, we have to be able to provide that service to those folks. So as we started to look around, and we ran into Teladoc, and we said, well, they're the largest in telehealth, but 60% of their 10 million plus calls a year are about chronic conditions. They don't have a chronic condition offering. We don't have a telehealth offering. They're international. We're not. We want to be international, but we haven't done that. They're already in more than 50 countries. They have a very well-established behavioral health person-oriented offering. We have the leading digital offering. Gosh, if we put the companies together, we get to the next phase of healthcare, which is called virtual health. Mm-hmm. And in virtual health, you don't talk about a chronic condition management, or you don't talk about even telehealth. You talk about, here's my healthcare experience. And that's what we want. In the past, you would say, oh, does that business have a website? Today, that would seem like a ridiculous thing to say, because every business has a website. That's part of it. We don't say, do you have a data science department? No, every business uses data science today. In the future, your offering will be arranged that says, I want it digitally, I want to talk to somebody, I want it on my terms. And that's why we did the merger, to create the largest in the world, the largest global virtual health provider. And that's why we decided to put the companies together. But I think that it won't be about silos anymore. A company that does behavioral health, or a company that does telehealth, or a company that does chronic conditions. It will be, where do you get your health care? And you want it on a variety of different ways, a variety of different services. Do I have it on my phone, or do I have it on my PC? Do I pick up the phone? Do I go into a center? It's all going to be one shared experience. And that's what, we were building. And I think you're going to see more of that. So, today in diabetes and in hypertension and behavioral health and weight management, there's really nothing like Livongo. Now, in weight management, there's some interesting innovation going on. There's companies like Noom and others that are doing very interesting work. So that's, again, you're going to see innovation, but I think increasingly it's going to need to be a part of something. I like Noom because I like the data science-based model they're using, and I love the retention aspects of it. It's not a short-term, use this for 30 days and you're done. That's an example of someone who's really innovating in an interesting way. But I think you're going to see a lot more innovation, a dramatic amount of change. It's interesting, Tina. We know about the terrible loss of life that came from the coronavirus and the economic challenges and the mental health challenges. I think when we look back, we'll also say that was a time when the world pivoted to a much more connected system of health, because we know that the virus doesn't discriminate by what country you're from or what color you are or what gender you are. And we are all one in this healthcare community. I think also we've seen a beautiful worldwide collaboration to, in record time, use science to produce vaccines. And I've heard scientists say that now that we've seen what we can do in such a short time, they are more excited than ever about the future. Well, we've seen that in digital health. In telehealth, we only had in the US between 3 and 8% penetration. In 3 months, we went to almost 100%. That was too much. But we're going to end up about 10 times the rate we were at, to about 40 or 50% penetration of telehealth. That's going to be a much more efficient, much more responsive system of healthcare. I mean, who of us wouldn't want to, in the middle of the night, we wake up and we have a pain or we have a challenge or a question about one of our kids or one of our parents, be able to talk to a doctor instantly and have her give us real guidance, or another medical professional. Today, the response in many cases is, unless you want to go to the ER, we'll see you next week. Well, that's not going to cut it anymore. We know that. So I'm looking forward to a very bright future in terms of what we can do in digital health.
Yeah, that's really, I believe, as tragic as the pandemic has been, it's really proved a watershed moment for digital health and the dawning of like what we can really achieve, we apply all these technological innovations. I actually have a question here from the audience for you, Glenn. It says here, did you face buy-in challenges from the interventional medicine community that are incentivized to do reimbursable and care less about at-home care? I guess they mean like reimbursable procedures in the clinic, in a clinical setting, as opposed to, at-home care or procedures.
Sure. Sure. Well, I think in the entire healthcare system, again, particularly and uniquely in the US, in some other countries, I think there's a different system. I might even argue a better system. But in the US, you have incentives. For example, the way certain people get paid, the only way a surgeon gets paid is to do surgery. So what would you expect him or her to do? Now, that's not because they're bad people. They've spent years training to do magical procedures to save lives. And when you go to them, you would expect them to say, I can help you by operating. But that might not be the best solution for you. So we have to get to a system that says they can be well compensated and taken care of if they don't operate in the same way as if they operate. We have drug manufacturers who simply charge too much money for medications like insulin. The cost of insulin has gone up 500% in the last 5 years, and yet the basic manufacturing cost has not changed one iota. So why has it gone up? Because people are profiting. And while I'm a big believer in the for-profit healthcare system, that has to be balanced with the right provision of care and fair pricing and the like. And in the US, we do about 30% of the procedures done in hospitals are done at home in other countries. So we know, if I was to say, you had to have some kind of therapy that was delivered, and I gave you the choice, Tina, would you like it done and you travel to the hospital, or would you prefer I send a nurse to your home to do it in the comfort and safety of your home? You would say, well, I'll do it at home. Except you might say that costs too much money. I can't afford that. But in today's world, we can actually do it at your home. It's safer. There's no exposure to coronavirus or any other infection. We can do that less expensively than at the hospital. but the hospital's not going to recommend that. So, so we have to have a third party arise that says, I'm most focused on keeping Tina healthy. I'm not most focused on getting her to come to my hospital, my clinic, my practice, using my drug. We have to have somebody who advocates first and foremost for you as the, and I don't like to use the word patient, so I'll call it health consumer. And second, for the people paying for that. That might be you, it might be the company you work for, that self-insured employer, or even the government. But today we don't have that independent advocate in place. And I think that's where you're going to see some of the most exciting new businesses come from.
Okay. We also have another question here, which I think is really interesting, seeing your experience in the chronic care realm, and we're talking about where the future of innovation within chronic care is heading. The question is, which chronic disease areas do you feel requires the most innovative focus directed towards it? I guess if I could like tweak it a little bit, there's the cardiometabolic sort of a set of diseases that Livongo and quite a few companies are already looking at. There's mental health. But what about other types of chronic disease area where you feel there's still, a unmet demand, unmet need?
Well, I think in almost every area, we have a lot of unmet need. I think cancer care is an area that there's a lot of dollars. I think, the whole musculoskeletal area and all the surgeries we're doing there. I think in pain therapy, there's a lot of work to be done. So I think, there are great opportunities across the board. But what I also think is it's not just about technology or software. It's about how do we use that to deliver truly better care? And how do we create experiences that people feel the same way about their healthcare experience that they feel about other experiences in the economy? So we can use digital technologies to make people smarter about their care, to make them feel better about their care. But imagine if you were facing a challenge like diabetes and you felt totally informed, totally aware of all your choices. You could make the best choice. And it wasn't about cost, it was about care. And that's where we have to get to. And I think we're on the way there. And I think we're seeing finally, with all the technology that we've seen over the years, it's going to come together. And in part because of the coronavirus, I think it's going to push it. But there's an old saying that says we often overestimate the impact of technology in the short term and underestimate it in the long term. I think for a lot of the technology in healthcare, we're in the long term, and we're going to see in the next few years an explosion of technology used to provide more choice, more information, and better care for the health consumers that we all are.
Okay, and I'm afraid we only have a few minutes left, but I would really like to get sticking to this theme about what's in the future for health tech. I'd like to bring up the topic of the new spec that you were part of the team for setting up, health assurance acquisition called HACC. And
yes.
Obviously specs is just it's like the buzzword. It has been for the last year, and I think will probably continue into this year. So there's a lot of competition for a lot of these specs looking into health tech. Which areas is HACC interested in?
Sure. Well, first of all, SPACs have come about in part because there's an enormous amount of money circulating, and people are saying, how can we best utilize that money? And so special purpose acquisition vehicles or corporations have come about, and people have said, listen, what about if we give this team of people, you all seem pretty experienced, we'll give you some money, find a way to deploy that to make a difference. And so under the leadership of Hemant Taneja from General Catalyst Corporation, he assembled a team of people. I was happy to be a part of that with him and others. And we're focusing, and we called it, rather than a SPAC, a hack. And a lot of people thought that was a play on the hacking something, but in fact, it was about something we believe strongly in, and that's healthcare assurance. And that is assuring that people get the right care at the right time. So we're focused on how can we look at businesses that are going to actually make it easier and for people to stay healthy, that are focused on driving care closer to the consumer, giving them options so they can take more charge of their health care. So we look at a variety of areas where we say, why shouldn't people be in more control? Whether that's in the areas of, if I want to know whether I'm healthy, I'd like to go out and get lab tests. What about that? What about areas of, giving me more access so I can get things delivered to me that provide the care? What about areas of technology that allow people to be more in charge, whether it's self-monitoring, not remote monitoring? So everything that puts you more in charge, that's what we're looking at. We've made no decisions yet, but we're seeing all the opportunities out there. And, we've assembled, we think, a really great team of people to focus on it. But I think you're going to see SPACs for a period of time while there continues to be a lot of money and people are putting together smart teams of folks to say, focus on this area. Tell us how you can use this money, whether it's 500 million or $1 billion, to literally change and accelerate the trajectory of how we solve these big healthcare challenges.
Right. I think that's a good note to end on. For health tech companies, know that there's still a lot of capital out there willing to be invested in these innovations and these innovative companies. So I just like to thank you very much, Glenn, for your time and your great insights. And thanks to those watching this session. So back to you, Becky.
Thanks so much, Tina, and thank you very much, Glenn, as well. Again, we went a couple of minutes over the allotted time, but if the discussion's good, we like to carry it on if we can. So I encourage you to reach out to Glenn and reach out to Tina if you've got any questions. And as always, connect with everyone on the platform. So we're on the final countdown. We've got about 15-20 minutes before the final session for today's content. We have a panel around the new 2021 digital health investment landscape. So have a little break and I will see you back here shortly.